Good morning. Today I wanted to talk a little bit about home health care and its impact that it can have on the geriatric population. To do this, I wanted to share a study that I pulled from CINAHL Plus entitled A Randomized Trial of a Multi-Component Home Intervention to Reduce Functional Difficulties in Older Adults. The study was performed by Laura Gitlin et al. And published in the Journal of American Geriatric Society of 2006. The study design itself was a prospective two-group randomized control trial involving 319 community living participants. Inclusion criteria included scoring 23 or higher on the mini mental exam out of 30, being 70 years old or older, English speaking, not receiving any additional home health care, and a self-reported need or difficulty with 2 instrumental ADLs or 1 or more ADLs. This was a 6-month intervention consisting of 4 90-minute occupational therapy visits and 1 20-minute phone conversation between the OT and the participants, and then just 1 90-minute physical therapy visit with the participant as well. PT focused on core strengthening, balance activities, and fall recovery strategies, while OT observed the participants through their ADLs, IADLs, and came up with different, what they called specific task-oriented strategies just to make their movements more efficient and to increase safety while they were performing these different ADLs. And there was also follow-up strategies to reduce environmental hazards around the house. This included home modifications, which were provided by grant funds, and these modifications were performed before the final data collection to make sure that the patient or the participants were using them effectively and efficiently and being more safe. So the 319 participants, they were randomized into 2 groups. 160 of them were in the intervention group, and 159 were in a control non-treatment group, not receiving any form of the therapy. And they did a 6-month follow-up as well as a 12-month follow-up, and 300 were still available for the 6-month follow-up, as well as 285 being available for the 12-month follow-up, and this could be due to mortality, institutionalization, hospitalization, just different forms of participants withdrawing from the study. And the primary outcomes that were observed in this study were mostly self-reported, and they included functional difficulties, including the ADLs and IADLs, as well as mobility and transferring around the house, self-efficacy, and also a fear of falling, which was based on the Falls Efficacy Scale created by Tinetti et al. And the secondary outcomes that were observed were adaptive strategy use, which is what I was talking about with the task-oriented control strategies they would use. And this would just be if they dropped something while they were walking around the house, how could they adapt to an unforeseen event where they would have to reach down to the ground, pick stuff up, or if they even fell themselves, how they could adapt to getting up from the ground. And so the results that were shown from this study showed that the intervention group that received the occupational therapy and the physical therapy, they scored, tallied all their scores between intervention group and the control group, and the score showed that the intervention group had less difficulty with IADLs and ADLs, with the greatest improvements being with toileting and bathing. And also they reported less fear of falling, which through the study they showed a correlation between fear of falling and just general quality of life. Less fear of falling had a relation to greater quality of life, which is important for these participants. And the secondary outcomes that were studied were their adaptive strategy use and home hazards that the therapists found around their house. And so, and they also wanted to make note that each of those benefits that I just mentioned were still evident at a 12-month follow-up with the 200 between the 285 remaining participants. The ones within the intervention group still showed that they had higher scores with these different outcome measures than the control group that received no additional home health therapy. And I thought interesting was a follow-up study that they did after. Laura Gitlin and her colleagues also performed a follow-up study where they studied the mortality rate between these two groups, and 12 months out, so a year after receiving the therapy, they showed a 1% mortality amongst the intervention group, while they showed a 10% mortality rate throughout the control group. So it just shows that with the implementation of an OT, PT, any type of therapeutic home health program, it correlates to increased function at home, decreased fear of falls, overall general improved quality of life, and as the mortality study shows, these participants can live longer and be more independent with these programs. So I thought it was beneficial to learn, and that is the gist of the article that I pulled from Cinol Plus. Thank you for listening.